Hello, my friends. As you can see, I am back on a fresh medical journey and it's got me fired up. Every couple of years, I get fed up with some aspect of my life being a constant struggle or dealing with a consistent level of pain, and I think I should ask a doctor about this. And because I'm privileged enough to have relatively decent health insurance through my work, I take myself on over to my primary care doc and say, hey, XYZ has been going on, and I'd like to figure out why. And then she usually orders some tests or sends me to a specialist, and I go from there. In 2021, it was my heart and whole gastrointestinal system, so I saw a cardiologist and a gastroenterologist. In 2023, it was an allergist, and in 2025, it's been a physical therapist and a podiatrist. And while we could talk about the hip and foot pain I've been dealing with when exercising and how the physical therapist and podiatrist are treating it, I have wanted to make a video on something I think is actually more useful than just my personal doctor's experience like I've done in the past. And that is how to get your doctor to actually listen to you. It's incredibly important to advocate for yourself effectively when you're navigating the healthcare system, particularly in the US. It's not an easy thing to do. I've been working at it for the last 15 or so years while dealing with chronic pain and illness, and I've watched my parents do it for my dad for the majority of my life. While I'm certainly not an expert at the American healthcare system by any means, I have kind of trial and errored my way into getting some medical professionals to actually listen to me. So let's break down some of my best practices. First, and probably the most important yet daunting step, is you have to find a doctor you like and vibe with. I know this can prove much more difficult than it sounds. Depending on your insurance, most people don't have the luxury of shopping around for a doctor. I mean, I have good insurance and I still find it exhausting. But unfortunately, it makes a big difference. I'll give you an example. For a few years, I had found a great primary care physician. She came highly rated, was close to where I live, she listened to my concerns, ran tests when they were warranted, etc., etc. Basically, a unicorn of primary care doctors. Then she left the practice, and I was paired with a new doctor who, while she was nice, I found I didn't vibe with or trust. She wanted to change some of my medications without fully understanding why I was on them, and she drug tested me at my yearly physical, which, as far as I can tell, is not a normal part of a physical, and I didn't consent to paying for those tests. The only reason I've been able to come up with for her doing it is that I did have a very high heart rate, but that's because I get very anxious at doctors and my heart rate and blood pressure usually shoot up. But joke's on her because I don't do drugs, so it was a waste of tests. But whatever. Anyway, I saw her for 2 visits and then she left and I was paired with another doctor who left after 1 visit. And at that point, I was just done with this practice because the turnover was way too high. And with a rotating cast of doctors, no one was going to be familiar with me and my issues, and I'm not going to get as good of care as I could and should be. So I switched practices, and now I'm seeing a nurse practitioner who I love, and she's been able to give me referrals, which got me to the physical therapist and podiatrist this year. I guess this is really all to say, if you're unhappy with your doctor, if you feel like they aren't listening to your concerns, you can ask to see a different doctor in your practice. Or you can find a different practice altogether. Ask your friends or local Facebook group what doctor they recommend. People usually have strong opinions about doctors and will tell you if a doctor comes highly recommended. I also want to make a note here that different demographics will have different experiences with doctors. Like historically, doctors have not listened to the concerns of women, and especially women of color, Black women in America. So I fully understand that there's even an extra layer and more hoops that you have to jump through to find a doctor that you vibe with if you're a part of a less privileged healthcare group. So just because I'm saying go find a doctor you vibe with, I understand that that's harder to do depending on who you are and also where you live. Like if you live in a rural area, there's less options for you in terms of what doctor you can choose. So maybe there's only one primary care physician in your small town, and if it's like an old white man who maybe has some bias. Anyway, I wanted to make that note before I got too much farther into the video, because all of these tips are coming from like a white woman in a relatively urban area with like decent insurance. So I have a lot more options. And I will say that when I moved from like a rural to an urban area and I had more options for doctors, I've been able to like figure more things out because I just like people listen to me more because I can choose what doctor I'm going to go see. Okay, back to the tips. Okay, second, assuming you found a doctor that you vibe with, before going to see them, you need to do your research. Now, don't go crazy with Dr. Google and diagnose yourself with some kind of parasite that you can only contract in the Amazon when you've never left the state of Nebraska. But use it as a tool to explore your symptoms and see if there are other related symptoms you're not recognizing or taking for granted because you've just always dealt with them. Part of living the chronic illness life is sometimes becoming so accustomed to certain pain and discomfort that it doesn't even occur to you that that pain isn't normal. So a little research can remind you that no, having heartburn every day, no matter what you eat, is not normal. And that seemingly unrelated issues might actually be related, and you should bring them all up to your doctor. Which brings us to tip number 3. Decide on a way to prioritize your pain, symptoms, and complaints when visiting your doctor. I ascribe to the belief that more information is usually better. But if you go in, symptom guns blazing, to your doctor's office and tell them every pain and problem you've had over the last 3 to 6 months, you might see their eyes glaze over in overwhelm. So my strategy for this is when I go to the doctor, I try to go in with one major concern I want to discuss. Like when I was dealing with my hip and foot pain, I went in knowing after Googling that I'd probably need a referral to a physical therapist. So that was my goal of that appointment. And once I've gotten my main concern talked through and have a plan in place for next steps, then, depending on how I feel the appointment has gone, that's when I bring up some of my minor concerns. These are things that don't feel overwhelming for me at the moment. Maybe they're not causing me too much discomfort or difficulty performing daily tasks, but something I want to have on record. Usually these discussions end with a watch and see, but sometimes my doctor might order some tests just to rule things out. My luck is that it's never solved through those simple blood tests. It's always something more complicated because my body loves to be a mystery. I hate that we live in a world where you have to temper your expectations going into the doctor and you don't want to tell them too many of your issues for fear of overwhelming them or appearing as a hypochondriac and they stop taking you seriously. But this is where we're at, unfortunately. All right, tip number 4 is my favorite because I am a nerd, I guess, but document everything. I learned this from my mom after years of dealing with my dad's medical mysteries because she'd show up to doctor's appointments with a binder full of notes on symptoms, past appointments, medications, and tests that had been run. I learned from the best. Now, when I say document everything, I mean everything. I mean, take notes after appointments on what you discussed, keep a list of medicines and supplements you take, who prescribes them, the dosage, and even past medicines you've been prescribed. Have a list of all your doctors and specialists and when you've last seen or will be seeing them. And track your symptoms. This is the big one. I have found doctors are much more likely to listen to you if you can look back at actual data you've been keeping and say, hey, I've been experiencing X symptom 2 times a week for the past 10 weeks with Y level of intensity. Make a spreadsheet, use a health tracker or journal on your phone. I use a journal app called Dailyo, not meant for health documentation, but it lets me add activities I can check off for each day. So I put in all my most common symptoms and then go back and see a chart of those symptoms and look for patterns. Figure out what works best for you, but find some way to start collecting data about your symptoms, and then when it comes time for a doctor's visit, you can have all that information on hand. Because trust me, I've had appointments where I'd been doing generally okay overall, so I went in without my usual prep work, and the time comes to discuss any issues, and I'm like, all good over here, I think. And not 10 minutes after leaving the doctor's office, I remember all the things I should have brought up, but my mind went blank while I was there. Okay, finally, tip number 5. You've done your due diligence with documenting. You've made it to the appointment. You've done your research and prioritized your symptoms. Now what? You have to make sure to follow up. One of the biggest mistakes you can make is jumping through all the hoops to get to a doctor, maybe get a diagnosis even, and be prescribed a medication that's supposed to help, and then you just don't go back. This defeats the purpose. Ideally, your doctor is supposed to walk this journey with you. You want to go back for regular follow-up visits so you can discuss how things are progressing for you. Are things improving? Did one symptom improve but another got worse or manifested itself? Do you need to try a different medication because the side effects of the first one caused more discomfort than the original problem? I know part of the reason people don't follow up with doctors is because of money. My husband is guilty of this because he has had some bad insurance coverage through the years. But it can also just be because it's tiring and no one likes going to the doctor. I have been guilty of this. It's especially tiring if you keep going to doctors and not getting answers. It's part of the reason I kind of go through phases of pursuing diagnoses on certain issues I'm having, and then I get burned out and I have to take a break for a bit. Symptom management, basically, not any active pursuit of a diagnosis. Then things will start to get progressively more uncomfortable and frustrating until I go back to the drawing board, so to speak, and start advocating for finding a reason behind the pain again. That's where I've been this year, and I've done something like 10 weeks of PT and now 6 weeks in a foot brace, which will hopefully all end in a lot less pain when walking. Also, turns out my left leg is like 2 millimeters shorter than my right leg, which apparently causes a lot more problems than you'd think. I don't know why I'm showing you my legs. It's not like you can tell the 2 millimeter difference, but my body sure can. But I will eventually get burned out again and have to take a break. So I guess unofficial tip number 6 is just remember to take care of yourself and rest amid all your searching for answers. None of this is easy. Being chronically ill sucks. And the healthcare system is generally not set up to help make any of this easier, but instead to make money. Okay, whew, that was a lot. I hope you find at least one little nugget of information that's helpful here, but I really hope you're being kind to yourself on whatever medical mystery journey you might be on, and that you get an answer soon. Now, do you have any best practices for doctors, the healthcare system in general, anything you want to talk about? Let me know down in the comments. And if you enjoyed this video and want to see more like it, don't forget to subscribe and give it a thumbs up and turn on that notification bell so you're the first to know when there's a new video. I'll see you guys later. Bye!